Well, good morning, everybody. I'm excited for the call today. My name is Savannah. For those of you that don't know me, I'm the director of our physician relations, and basically everything that I handle is in the wheelhouse of marketing, whether it's to physicians, which is my specialty, ALF, ILF, to home health companies, as well as just to patients in general. I've been doing this now for almost 10 years, if you can believe it. And I think I've fallen just in love with the practice and just being able to help patients get to our services. And now through PTTU, helping all of our therapists become their own best marketers. And so to the call for today, I really want to focus on the nuts and bolts of things that we typically tend to shy away from as we go along. And we can sometimes go down these rabbit holes of continuing to provide a lot of information, but not really get the person on the other end of the conversation bought in, because we're so used to just informing, and educating that sometimes we fall away from the essence of marketing of itself, which it's an art of persuasion. So that's what today's going to be about, is the art of persuasion. So, just to start, we're going to talk about knowing our audience, which is the who. In this case, our audience, of course, is going to be physician offices, but also our audience, of course, is our patients. So, we have to know the difference between how we're educating patients and how we're kind of getting them bought in versus how we're getting our physician offices, ALFs, and home care agencies bought into utilizing us and our network in general, which this could be how you're speaking to people on LinkedIn. It could be in a number of different ways. So there's going to be little nuggets as you go that can certainly apply to your version or your way of marketing. So, persuasion really begins with the understanding of what matters most to the person that we're talking to. In the world of physician offices, they care the most about patient outcomes, reduced readmissions, hospitalizations, and reducing the risk of falling, which ultimately becomes really a liability on the doctor because all of the things that happen naturally after that initial fall. Where they just become more of a high risk patient. They're concerned about the patient more than they would have been before. Also, I think another part of kind of persuading your physician office that you have that you're curating a different experience in a traditional home health group or a traditional outpatient group is just you holding that authority and you being that point person within that office versus a marketer or versus someone that is representing the company but not necessarily the person providing the care. Even physicians will go around and market themselves to other doctors and go into offices. So we're really kind of embodying that same type of dynamic when we're going in and marketing to them. In the ALF world, they care a lot about obviously resident satisfaction, family peace of mind. That's a huge piece to it, and reducing fall risk as well. They obviously too care about smooth transitions, positive outcomes, because that reflects well upon the ALF when the patients are doing well, they're progressing, they're not falling, they're happy, they're able to do more within their communities, be more active, be more social, and ultimately, again, reducing the risk of falling. So a lot of it has to do with the family members, the resident satisfaction, and then just overall building a greater influence within the community. And the other route would be home health agencies. They care about effective discharge planning, smooth transitions, and positive outcomes. They are judged by if their patients go back to the hospital, that affects their star rating. It affects obviously the patient's health and well-being if they're being discharged and they don't necessarily have a place to go upon discharge and they're not, maybe they're not quite homebound, but maybe they can't get into a clinic. And so, effective discharge planning, we are really the answer to that question for all of those patients that really get kind of plopped off at the end and they still need an expert level of care, but maybe aren't appropriate for home health services or don't need a nurse anymore. Now, of course, with our patients, you all know best because you're seeing them every day. But at least from my perspective, and being the one that is communicating with them from the office standpoint, they obviously care about their independence, they care about convenience, and they care about their quality of life, and their autonomy, their ability to go out and do what they love to do without being a burden on their family members or being a burden on their spouse or being a burden on really anybody around them. So, the question that I would be asking myself, like if I were this person, whether it's in the office, if it's the patient, if it's in the community, or if it's that person on the other end of LinkedIn, what would make me say yes to PTTU? What would be that reason? And it's going to be different for everybody, especially because all of us have different areas of expertise. But what would be that reason that I would say, oh, yes, Jody's the right person for me? That therapist is going to take great care of my patients. And I know because X, Y, and Z. So it's kind of a tougher question, maybe something that we can chew on a little bit and use that as your fuel to like create and curate your marketing dialogue and then push that back out, because ultimately then you are giving that person on the other side of it a reason to almost sell you to themselves without you even having to do anything. So that's really where I wanted to start, was just knowing our audience in general. After we really like have dug down into the topic of, okay, well, who's our audience? Who are we marketing to? Next up, we're talking about building instant credibility, which is a really tough task because there are hundreds of providers that assimilate similar styles of care. There aren't hundreds of PTTUs. That's really the beauty of us being in our own little niche in our marketing lane. But how do we build this instant credibility? Like, why you? So really the answer to that prior question. People only say yes to who they trust. It's just like when you call a patient to schedule and they're like, "Who is this?" They immediately don't trust you because maybe you sound like a robot, or maybe they know the doctor referred you to them, but they're just people immediately are guarded. They're very hesitant, of course, especially in allowing us into their homes. So people say yes to who they trust, and how do we build that trust quickly? Because that trust has to be built not only within your first interaction with that practice, that office, or with that patient, but it has to be built quickly by whatever you're verbalizing to them, which is kind of a challenge because, of course, once you're in that patient's home, there's all sorts of things that you're doing just by putting your hand on their back and saying, I'm so excited to care for you, and just all of the little things you do that curate the experience that in whatever way you show you care. And that builds trust, of course, and them getting better obviously builds that trust. But other ways that we can wrap into this that help us build that credibility too are by mentioning our evidence-based outcomes. Patients on average that come into my practice and I get to see them for 2 to 3 months, for 2 to 3 times a week, you wouldn't believe the amount of progress that they make. Mrs. Susie was falling left and right, and all I had to do is make a couple of adjustments to her home setting and get her comfortable and confident with using a walker only when she's out, and then when she's in her home, or whatever the case is, like however you're building and curating that experience with that individual patient and expressing that to the office in a short and concise way, that builds instant credibility, because that paints the picture of another patient that's walking into that office that needs the same thing, or paints a picture of their friend or their family member that needs that same thing. And so if you can do that within a quick 2 to 3 sentences and rope them into it. So maybe another way to do this would be you're talking to somebody and you can ask them, "Oh, have you ever had a family member that's had a fall before?" Or, "Oh, have you ever seen a patient come into their office and into your office and look super unsteady?" Because obviously the answer to those are going to be yes. Everybody knows somebody that's had a fall. Everybody has seen a patient coming into their office that you're questioning how they even got into the office in the first place on their own. And all of those patients and all of those people are candidates for our care. So by doing that, we can share testimonials too. And that's another route in building credibility. Testimonials, like even if you only have 2 to 3 past patients, just having that in a quick printout with your PTTU, name, phone number, fax, you're immediately going to have that credibility. And patients too, they're loving that convenience level. So even if the testimonial is just saying, "Jody always showed up on time, Adam always showed up on time, and the visits were always very effective, and I felt better and stronger by the end." That's a great testimonial. I noticed that when my therapist came in for the visit, they were always here for 45 minutes to an hour. And I noticed with other companies, they would always cut out quickly. So I love that they come in and they really take their time when they're working with me. Or my therapist actually walked with me outside to my car to show me after I broke my arm how to comfortably get in and out of my car and safely. So testimonials can be such short clips that carry so much weight and so much power. And then the third part of building instant credibility is going to be just showing your professionalism. It's such a small thing, but it really makes a difference because we've all seen that therapist or that doctor that has kind of walked in and you're questioning already their authority based off of how they're presenting themselves and their professionalism. So you're by the way that you present yourself, even if you don't always feel confident putting yourself out there, because it's a tall task. It's not easy to feel confident always in putting yourself kind of exposing yourself, because you're really you're in a space where you're not really sure how they're going to receive you, but if you show up, friendly is always the most important thing. Even if you're not received well, being friendly goes a long way. Everybody's having a tough day. Everybody's dealing with tough patients, or patients are dealing with pain, or your community, whoever you're reaching out to in the world, everybody's going through it. And so if you can always lead your conversation with kindness in a way it's not cheesy, it's not fake, like it has to be true, authentic kindness, which in being a therapist, your whole like life's work is to help people and to be kind and to get people stronger and moving well. So that's the easy button for all of us. But alongside being kind, being confident, and being concise, not being too wordy, keeping things short, concise, and quick. Like I said, 2 to 3 sentences, at least when you're just introducing yourself or getting a conversation started. Because if you're just talking and talking and that person on the other end doesn't really have the opportunity to receive what you're saying, and then maybe computer response, it starts to feel like you're just being like talked to instead of brought into the conversation and valued for whatever type of feedback or questions that other person has. So building credibility can look like a number of different things, but it definitely looks like giving examples of past patients, asking really good questions, and being professional in how you show up. So we'll kind of move forward now to overall, and I actually had a whole call on this too. So if you'd like to look back through our video bank, there's a great one about like the psychology of sales and the psychology of persuasion in general and how to bring these in naturally to a conversation, which is actually a lot easier than we think. There's a couple of different, like I would say, like persuasion triggers. And so these are the triggers that I'm going to talk about next. So first things first is your trigger is your authority. The fact that, and I mentioned this earlier, but you're walking in as that licensed professional versus a me who is like a seasoned marketer or somebody that has worked in a clinic but isn't the person at the end of the day seeing those patients. Referencing your experience, your certifications, your specialties, the patients that you love to see. Hi, my name is Becca, and I love seeing pelvic floor patients. I know it's a little bit of a niche profession, but actually you wouldn't even believe the amount of people that need this care, and you can't find it. So that's exactly why I wanted to come in today, because I was looking at the types of patients you see, and I'm noticing that I think a lot of these people need the kind of care I provide. So I wanted to show up as a resource in your community, so that way you know where I am, that I exist, and I can see your patients that are literally right down the street from you. I mean, how awesome is that? It just You're like an answer showing up to a question they never even knew that they had about their patients. I'm a specialist in fall prevention. The past 4 patients I've seen haven't had a fall in the past 3 months. Knock on wood, or whatever way you want to put it. But authority is definitely a trigger in persuading people to trust you and persuading people to use you for the first time in referring a patient. The other part is, like we talked about, our social proof, success stories, data. showing how many patients or people have already kind of trusted you. Oh, I work with Dr. Smith down the street. I actually love working with his patients. He typically sends me all of his patients that recently were discharged from home health, or sends me all of his patients that he's worried about having falls. And he actually only sends me out for a one visit fall assessment. And if I see a need for more therapy, I'll give him a call and we work on curating programs for his patients that need additional care. Scarcity mindset is going to be another way to persuade offices. And obviously scarcity is, it's a word that you're kind of like, why scarcity? But a lot of people have limited availability. Patients can sometimes wait weeks unless they're going to home health. But again, you have so many upsides adverse to a traditional home health episode that being an outpatient provider that can go out to see a patient within the same week is truly almost unheard of. Patients that are calling into offices are having to wait at bare minimum at least a week or two. And in some cases, for some of our therapists in more remote areas, are having to wait weeks, if not months. And this is all factual information because we have therapists that are all over the state of Florida. So when you're offering the fact that someone is coming into that office that same day, and just say, if you have anybody that comes in today, I can see them this week. So just send them over my information, or send the fax over our way, and we're going to get that patient started right away. And I'm going to give them a call as soon as I see that fax come through. So all of that is just presenting that although there is scarcity in general in the outpatient market, you're offering a way to see that patient quickly, efficiently, and with you. You're the direct provider for that person. Another persuasion technique, consistency. Consistency is where everybody at some point falls off the map. You start getting a couple patients, you feel great about it, and then you just stop showing up at the office. So, and this has happened to me too, where I started getting patients, they were coming in, everything's going great, and then, well, okay, well, I've got the patients coming in. Why do I need to go back to the office? So I'm not going to go in until next month. Well, I go in next month and they're like, "Oh, we were worried about you. What happened? Where have you been?" So they're already they're already trying to figure out where you've been. So consistency in how frequently you show up for them, and even if it's only a 2-minute visit, it absolutely matters. Stay consistent, get into those spaces and kind of ask them, how frequently should I be coming in? Is every couple weeks okay with you? And that way they know you're setting the expectation of how frequently you're going to show up there. And then the last technique that we talked about already is just being relatable, being warm, and being approachable. Finding something about the person that you're talking to on the other end that you can relate with, whether it's a hobby, whether it's weather. It could literally be anything, but the more that you find synergies with the people that you're trying to connect to, the more that they see you not as like some figure or some separate entity from their office or from their network. They start to see you as a part of it because you're relating with them. So it's a simple thing, but it's something that really carries a lot of weight and a lot of power. And that's really how I've seen a lot of success within marketing in general. So next we're going to talk about just like the solution of having a problem and then having a solution, which we briefly touched on earlier. Which a general problem in outpatient therapy is compliance. Patients missing visits, patients canceling visits due to weather, due to being sick, due to not feeling well, due to not having a ride. I mean, the list could go on for eons. But kind of a way to shift that conversation and a way to bring that up to the people that you're marketing to, and even if it's the patients themselves, is saying, and again, bringing in relatability. I know it can be tough to get into the office. I know it can be hard to commit to therapy. And that's exactly what I'm here for. I'm here to keep you accountable. I'm here to show up for you, even on the days that you're not feeling that well. And even on the days that you're wondering if you're going to be strong enough, or you're going to be able to do this, or maybe you have a full day of appointments and it starts off with therapy. And then you're thinking, oh my goodness, I'm going to be so tired. Well, don't worry. That's what we're here for. I'm going to find a way to see you and provide value in your session that's not going to have you feeling depleted by the end. And just like, again, finding that way to curate the relationship, that enhances the compliance, but also you're providing a solution to the reason that these patients are continuing to be rehospitalized because they're not being consistent and compliant with care. They're not doing their home exercises. They're not showing up for their appointments. So by us going directly to them and giving them a full, the full session of care, it's going to lead to faster recoveries. It's going to lead to better compliance and fewer complications on the back end for that doctor to manage. Because obviously, one fall equals X-ray, MRI, hospitalization, surgery, follow-up visits. That's 5 other problems that they just created that could have been prevented if we could have just gone out and seen that patient. So overall, I think it's really important to present any type of problem or any type of, I guess, red flag for a patient that is not really wanting to commit to it and just saying, like, this is the reason why we exist. We exist because we are therapists that want to see our own patients. We want to have our own businesses, and we want to be really valuable resources in the community. So I know that's a lot, but I want to kind of rope it all together in a way that we can like have some takeaways from today, which is going to be by doing like basically role play, and making it practical, by like sampling your persuasive pitches or how you're wording um, your your pitch to these offices and to these patients. So I wrote down a couple of examples that we can use. So I'm going to just read off of them so that way it like, you've got something that you can pull from today, and maybe you're taking notes, or maybe like you can listen to this again and kind of repeat it a couple times and then use your own version and take that version away as you go out into the world and heal patients and build your business and build your practice. So for physicians, Dr. Jones, I know one of your biggest challenges is your patient follow through after discharge. PTTU, myself, as a therapist, I remove that barrier by going to your patients straight to their home, dramatically improving their compliance. Would you like me to send you any type of report on the outcomes after I see your patients? What would be the best way for me to continue to communicate you about my first referral? So one, that insinuates that you're going to get a patient from them. 2, you're trying to find a way or a map that works with them. And then 3, you're showing them the problem that they typically have with patients, which is compliance, and then flipping it on them and showing that you have the answer to that issue. And then you also are presenting the solution and a longevity solution. Another piece to this, which I didn't even put in this, but it's coming into my head right now, is our care calls. We call patients towards the end of the year and every couple of months to check in on them. That's a huge way to keep patients accountable for their health care. We're keeping them accountable by saying, you know what? You're right. These past couple months, I have not been doing well since I stopped therapy. I stopped doing my exercises, and that's why we manage our visits, and that's why we manage these patients' care so efficiently, is so that if they need care at the beginning of the year, in the middle of the year, and the end of the year, they can, because we didn't eat up all their visits in the beginning of the year. So being that authoritative figure, being accountable, and also providing what's appropriate and necessary and keeping tabs on our patients, because sometimes they're skipping those primary visits. Maybe they're only going once or twice a year. Ideally, I'm sure the doctors want them to go in 3 to 4 times a year, but if they're not, who's checking in on them in between? It's got to be somebody. And if it's us, again, we're going to be the ones preventing other things from happening on the back end. So for ALFs, what I kind of pitched or wrote down is at the end of the day, all of your residents, they want to stay active, and your families obviously want peace of mind. So I would be so honored and so excited to see your patients and your residents, sorry, don't say patients, say residents, moving safely in your facility. I'd love to come in and do a 15-minute fall prevention seminar for your residents. Would you be open to doing that? So 1, you're creating the authority. 2, you're persuading them that patients, family members, people want to attend stuff. They want to have fun. They want to meet other people that are going through the same issues with them. And then 3, you're providing a way to do it to them that is at 0 cost, but to you, 15 minutes, and you could generate several patients just from that simple fall prevention seminar. And alongside that, you're going to obviously help prevent falls and keep their satisfaction scores for the ALF high. For home care agencies, we make your life easier by ensuring patients transition smoothly out of your care and efficiently, so that way they don't end up back in the hospital. But if for any reason we see a decline in their status, or we were contacted that the patient was rehospitalized, you're going to be that first person that I connect to because I have all of your patients tagged to your agency. So I will see that and I'll let you know so that way you can be the first one that gets back in to care for that patient. So one, you're generating referrals for that agency on the back end. Two, you're being that consistent resource so that they trust sending more patients over to you, and you're preventing them from getting PEP from another home care agency because unfortunately a lot of times in this world, in the medical world, especially in the hospitals, when patients are getting discharged, they have preferred agencies, so they might get routed to another place, and sometimes the patient doesn't remember the name of the agency, but they're going to remember your name, and they're probably going to have you plugged into their phone because they have your cell phone number instead of a random company name without like a personalized aspect to it. And the last part is for patients. Patients, I think, is like the best part because you're also, by talking to them, talking to their entire network of all of their friends in their community and people that need their care. Which is why, by the way, I love when we like do visits where we're going outside, we're walking with them to the mailbox, we're walking outside, because what if you meet another neighbor and they see you working with them and they're like, oh, wow, I kind of need that. I have a hard time getting in and out of my car. Anyways, so for patients, so the good news is that by me coming to you, because sometimes they're like, I don't know if I want someone in my home. Maybe I do want to go into the clinic. By me coming to you, you don't have to sit in your traffic. You don't have to submit yourself to sitting in the clinic and waiting for someone to see you. And on top of that, they're probably seeing three patients at the same time as they're seeing you. So it's more of like a group setting. But if you're looking for a more personalized approach to your care and someone that is really going to get to know you on an individual level, and you want to heal faster and you don't want therapy forever, then I'm going to be your answer. I would love to come out to see you in the comfort of your home. By me coming out, you don't have to sign up for all of these visits. I'm just here to help you. Let's talk, let's meet, and maybe we can find a way that I can help you feel more comfortable and confident in your day-to-day life. And then make it personal. What do you love to do that you're not able to do? Or what's bothering you right now? I mean, yes, general question, but people like being answered that or asked that because typically in the offices they're kind of being cut off during those questions and they only have 10 to 15 minutes in the doctor's office visit. Whereas with you, you have the opportunity to build a long-term relationship with them and get to know them like you are a part of their family because you literally basically become a part of their family. So yeah, I hope that all of this kind of provided some insights or maybe just a word or a nugget or something that you can pull into the way that you care for people, the way that you market out in the community. Take some with you and go spread your wings and have an amazing day.